pharyngeal branches to supply pharynx, especially stylopharyngeus muscle. It supplies. Yes, and after that it gives branch to the carotid sinus. So carotid sinus, we know it is located at the level of bifurcation of common carotid artery. Yes, so here we can see a branch. And no, it is rich with chemoreceptors and baroreceptors. Yes, and so this branch helps us to regulate blood pressure and chemical composition of the blood. So it is glossopharyngeal nerve. Now 10th pair, it is vagus nerve, nervus vagus. It is also mixed nerve with autonomic fibers, and it exits also from the cranial cavity through the jugular foramen. And this nerve, it's very easy to find. We find the main neurovascular bundle in the neck of the neck, yes, which consists of common carotid artery and what is this? Yes, internal jugular vein. And next to it, we will always find vagus nerve. Yes, this one is vagus nerve. Or where else we can see? But this is common carotid again. This one is vagus nerve, nervus vagus. So it is the longest cranial nerve because it does not supply only head and neck, yes, but it continues into thoracic and abdominal cavity also. And due to it, in vagus nerve, 4 parts are distinguished. First part, which is located inside cranial cavity, intracranial part, it gives only 2 branches. It is meningeal branch to supply meninges of posterior cranial fossa, and also auricular branch to supply skin of posterior part of external acoustic meatus. Then cervical part, which is in the region of the neck, it will give some more branches, such as firstly, superior laryngeal nerve. Yes, it will supply superior part of the larynx. It will come up to the larynx and get divided into 2 parts, 2 branches, external and internal. Internal branch will supply mucosa of larynx above the vocal folds, and external branch will supply muscles of the larynx. All the muscles of larynx except cricothyroid muscle. Also, vagus nerve will supply muscles of the palate, all the muscles of palate, we said, except tensor veli palatini muscle. Yes, because tensor veli palatini is supplied by trigeminal nerve. Then this cervical part will also give superior cervical cardiac nerves, which will move downward to the thoracic cavity, to the heart, and they will form superficial and deep cardiac plexus. Pharyngeal branches it will also give. Yes, this pharyngeal branch will participate together with glossopharyngeal nerve, will participate in formation of glossa of pharyngeal plexus. And then boundary between cervical and thoracic part, it will be superior thoracic aperture. And the very first branch from the thoracic part, it is recurrent laryngeal nerve. Recurrent laryngeal nerve, right recurrent laryngeal nerve, will surround right subclavian artery and move upward, and left it will surround arch of aorta and will also move upward, and it will continue. It will pass between trachea and esophagus, and it will continue as inferior laryngeal nerve, and inferior laryngeal nerve will supply inferior part of the larynx and also cricothyroid muscle. Then in thoracic part, vagus nerve will move next to esophagus, yes, from the right and from the left, and this thoracic part of vagus nerve will give esophageal branches, tracheal, bronchial, mediastinal branches, or to supply organs of mediastinal. And then it will, together with esophagus, it will pass through the diaphragm in esophageal hiatus of the diaphragm, yes? And then the left vagus nerve will move slightly forward to anterior surface of stomach, and it will continue as anterior vagal trunk, and right vagus nerve will move to posterior surface of stomach, and it will continue as posterior vagal trunk. So anterior vagal trunk will give anterior gastric branches and also hepatic branches to supply anterior surface of stomach and also liver. And posterior vagal trunk will give posterior gastric branches, and also it will continue as celiac branch to form celiac plexus. Celiac plexus is the largest autonomic plexus, yes, in our body. It will surround celiac trunk and its branches. So all the organs which will receive blood supply from branches of celiac trunk, they will also receive nerve supply from vagus nerve. And then it will continue also to superior mesenteric artery and its branches. And so all the branches, all the organs which receive blood supply from branches of superior mesenteric artery, they will receive nerve supply from superior mesenteric plexus, yes, and especially from vagus nerve. So in total, vagus nerve will provide innervation in abdominal cavity up to the level of left colic flexure. Yes, up to the descending colon. Descending colon will be supplied by the other parasympathetic fibers, and up to the descending colon it will be vagus nerve. Okay, it is about vagus. Accessory nerve, nervus accessorius, it is purely motor nerve, but it has a long nucleus. Yes, it starts in medulla oblongata and then continues up to the 5th or 6th cervical segments of spinal cord. And that's why there are two roots in it. There is cranial root, which exits through the posterolateral sulcus, yes, of medulla oblongata. And there is spinal root, which exits through anterolateral sulcus of spinal cord. And then spinal root enters cranial cavity through foramen magnum, joins cranial root, and altogether they exit from the cranial cavity through jugular foramen. And then outside of the cranial cavity, accessory nerve gets divided into two branches. Again, yes, external and internal. Internal branch joins vagus nerve and goes to all the branches of vagus nerve. External branch supplies two muscles, sternocleidomastoid muscle and also trapezius muscle. And so 12th pair of cranial nerves, it is hypoglossal nerve, nervus hypoglossus. It is also purely motor, and it exits from the cranial cavity through hypoglossal canal. And yes, to find hypoglossal nerve, we should search for hypoglossal, lingual triangle. Yes, lingual triangle. We remember that lingual triangle. Yes. How is it bounded?
Superiorly by the hypoglossal nerve and the anterior and posterior digastric muscle.
Yes. And for that, again I lost it. Here I think, yes. But here we can see anterior and posterior bellies of digastric muscle. Yes, this is digastric muscle. This is anterior belly, then tendon, then posterior belly. Here from above we can see this one, it is hypoglossal nerve. Yes, this one. Here. And here it should be lingual artery. But lingual artery is not here. But it should be. No, but this is for sure hypoglossal nerve. Yes. And so hypoglossal nerve, hypo means under, yes, glossa means tongue. So it goes under the tongue and it supplies 7 out of 8 muscles of the tongue, yes, except palatoglossus muscle, because palatoglossus is at the same time muscle of the soft palate, yes, so it is supplied by vagus nerve. And also we remember that hypoglossal nerve gives superior root for formation of deep onset cervicalis. Inferior root is formed by cervical plexus, superior root by hypoglossal nerve. They join together, and then from it branches start, which supply all the infrahyoid muscles and also geniohyoid. Yes, one muscle of geniohyoid. So that's it. Any questions? No questions. At the next lesson, again, you will have to write nerve supply of of different organs of head and neck, muscles, yes, because now we can supply all the supra and infrahyoid muscles, and not only head and neck, but also thoracic and abdominal cavity. And certainly you have to know preparations. And as you see, yes, not all the branches we can see in the preparations. That's why we will try to go to the museum next week. So that's why I recommend you in advance to go to the museum and see branches of this cranial nerves. So that's it.